I'll talk just about a common everyday case of gallbladder disease. We have an ultrasound in our office, so we're able to make that diagnosis. But that person, if they have private insurance, probably will have their gallbladder taken out within a matter of a week or two at the longest. A person with Medi-Cal, depending on the type of Medi-Cal, the HMO Medi-Cal, probably will be closer to a couple months and require several trips back and forth to Fresno. That's one thing I was emphasizing when I spoke with Michelle, is that that trip from Firebaugh to Fresno to have a blood test, to have a pre-op, to have this or that, is 100 miles round trip, usually winds up costing that person about $100, including the gas and whoever's going to drive them to the thing. So our thought always is to try to help minimize the number of trips that simple procedure, well, I shouldn't say it's a surgery, but the preparation for that surgery would take. A person with no insurance, like the client that Michelle is talking about, that person will be months and months before they can get an appointment in the surgery clinic in our safety net clinic. So like Michelle said, everything depends on your situation.
And have you run into situations where you felt that patients were in a life-threatening situation because of difficulty accessing a specialist?
Pretty much on a very frequent basis, unfortunately. I shared with Michelle the story of a patient. This was a 30-year-old woman who had been married for 10 years and with primary infertility, just dying to be pregnant and dying to have a baby. When she came in, and the happiest day, she had a positive pregnancy test. She also mentioned to me about a lump that she found on her leg. And I'll make a really long story short. She definitely was pregnant, and she had a sarcoma growing on her leg. And she wound up admitted to the hospital because that sarcoma, by the time that we were getting the appointment for her with the oncology department, which at that time had a half day in the safety net, half day per week for Fresno County in the oncology department. By the time we got the appointment, she was in respiratory distress from the spread of that tumor to her lungs, wound up in the emergency room in a hospital that couldn't deal with her case because she was pregnant, and chemotherapy and pregnancy don't mix. So to make a long story short, she stayed in the hospital almost 2 months waiting to be transferred, waiting to get some form of medical care, medical insurance, so that she could be transferred to a hospital that could deal with that complex situation, and wound up dying of that situation at 30 years old. So that story will always stick in my mind. When I see any part of her family, I'm ashamed of our medical care situation, and no one could say that she would have been saved from that serious tumor that she had, but at least she would have had a chance.